All right. Hey, everyone. Thank you for joining us today on this month's episode of Ask a Dietitian. Hope everybody's enjoying their holiday season. Today, we're here with Whitney Canfield, who is the one and only NICU dietitian at Augusta University Medical Center. So, hey, Whitney, thanks for joining us today.
Yeah, thanks for having me.
Totally. Can you start off by telling us how you ended up as a NICU dietitian?
Yes. So, when everyone has a dream, right? When their internship and being like, yes, I'm going to do this. Well, pediatrics was kind of it, but then it also streamed right towards like, nope, I want to do bariatrics. I want to do adult. And so I moved down here to Augusta for an adult Ross position, which was the traveling regional support dietitian. But had a background in some pediatrics from my first job, and the pediatrics job opened up. So I took that and then fell in love with like the acuity of patients and the need of little ones. Like give me 2 and under, and I'm loving it. And so when the NICU job became available, I applied, and it's been amazing so far. But that's kind of how I fell into it. And yeah.
Yeah, awesome. So what does your day look like as a NICU dietitian?
Yeah, so I start my day, normally rounds start around 9 a.m. and then we have rounds every day, even on the weekends, but I'm not here for that. So I will come in a little bit earlier before rounds start to prepare for them. And for how I prepare is just making sure, or I'm maintaining their growth, or I guess monitoring it. And so I'm looking at growth, length, head circumference, and then I'll be looking at the nutrition labs that we get based off of our feeding protocols, feeding guidelines that we have, pending on the baby's birth weight and gestational age at birth. But I will prepare for all of that, and then I'll go to rounds, give any recommendations that I have, whether it be switching formulas, going up in calories, down in calories, based off of their growth. And then I will come back and do my charting. And then if there's any discharges that are coming up, I will get that ready. I do a lot of like the WIC prescriptions. I help the team with that. And we have something called Helping Hands, which is our formula distribution, I guess. For when they go home, we get them an extra formula just to get set up with WIC. And so I help them with all of that. And then if there's any infants that are on like a specialty formula or specialty mixing, I will go through that education at discharge with them. And so the remainder of my day is either filled up with paperwork or charting or doing some of that education.
Gotcha. Sounds like you definitely stay busy.
Yes, definitely, but a good kind of busy.
Yeah. Can you tell us what the most rewarding part is for you?
Ooh, I think a lot of things. And so I would say the most rewarding is being able to see them go home. A lot of these babies are so early. I mean, we just had a 22 and some weeker graduate from our NICU. And so, 22 weeks, that's only halfway through pregnancy. And so they're definitely not eating by mouth at that time. And so seeing these babies that are started on TPN and started on tube feeds go home on drinking almost everything by mouth, if not everything by mouth, is pretty spectacular. And just seeing their growth. And then I also am in NICU follow-up clinic, which is just once a week. But with that, seeing them at their 2-year-old appointment and seeing them how great they have come, that's huge. It's not just nutrition, but I think we have a part.
Yeah, absolutely. Huge part for sure. Is there anything else you want to say about being a NICU dietitian before we go today?
I don't know. I think that's it. It's a great place to be, I think.
Yeah, you seem like a great fit for it too. You're doing great work. Well, thank you everyone for joining us. And thanks again, Whitney, for tuning in. And I hope everybody has a great new year, and we'll see you all next month.